Live.
I know, yeah, so welcome everybody. I'm waiting to see it populate onto the YouTube page. Let me just refresh. Okay, great, perfect, I can see you. Yeah, so welcome everybody. I'm waiting to see it populate onto the YouTube page. Let me just refresh. Okay, great, perfect, I can see you. All right, so welcome everybody. We're really excited to be starting our first live webinar as part of the Early Childhood for Sustainable Development course at the SDSN Academy. And we're really thankful for everybody who's joined us here today on the live Hangout, but we will also be posting this later for anyone who missed it. If you have any questions or comments or would just like to introduce yourself, please feel free to type into the live chat, which is on the right-hand side of your screen. I will be fielding questions, and Dr. Hirokazu Yoshikawa will be discussing both questions we received today during our live chat, and then also those that we've collected from the online platform. All right, so to begin, our first question from the live forum is from Nina, and she asks, what do you think about whether there should be universal goals or context-specific goals with respect to diverse countries like India? So I'll turn it over to Hiro, and he can say hello and respond to this first question.
Sure. First of all, welcome to the course, kind of in person. I'm delighted by the very high level of response and the high level of really expertise and background in early childhood development that many of our students, I think, look like they have from the survey that's on the course website. So from those responses, I think we've gotten quite a sense of the tremendous diversity of the students who really are from all over the world. And acknowledge, I think that, as I think, Mina, you're saying, that there's a great deal of diversity within countries. So the Sustainable Development Goals are certainly framed as global goals that each member nation of the United Nations signed on and gave some input to. There was, as you know, a fairly inclusive process leading up to 2015 in which the viewpoints of really all the member nations were included in the debates and discussions that led up to them. At the same time, they are conceptualized as goals that could be useful, and not just the global level, which would be kind of comparing countries, but also at the regional level and then also at the national level, that they are meant to drive national level progress. But of course, national level progress in different countries means different things. And so I think within a country as diverse as India, and with a governance structure like India's, there has to be attention to the notion of governance at the state level, at the local level, within states, within taking into account the diversity of home languages, of ethnicities, of different contexts. And so those are certainly aspects that should be considered in the implementation of any kind of national goal making. So I'm glad you've raised that point. And later in the course, when we talk about how programs become policies, we'll have a great deal of discussion around some of these issues of home language, taking into account diversity between rural and urban populations, between indigenous populations, and those that aren't, different groups, and how to take into account that diversity in thinking about commonalities like quality in ECD services and what the outcomes of early childhood development are expected to be. Sarah, do you want to say a little bit more about what we're finding from the survey before we take the next question? I know you have a little bit more of a sense of those numbers and stuff.
Yeah, sure. So again, we are just so excited to have such a global and to a certain extent representative course participant population. So as we see, the distribution across countries is really dramatic in that we have people reporting in from all the different regions that we are assessing. So for example, 18% or so of the population of course participants that have currently responded to our survey are reporting they're from North America, followed by 17% that are reporting from Sub-Saharan Africa. And then we have about 11% from Europe, and then the Caribbean and Central America, South America, Middle East and North Africa, South Asia, and Southeast Asia, each are reporting about 6 or 7%. So we've got a really wonderful distribution across the globe of people participating in the course. And one of the things that's most exciting about that is over 40% of the course participants have more than 10 years of experience working within ECD. And a lot of these course participants themselves have also had training or report being a part of academic programs about ECD. So we're really excited that both, people are presenting, and then also that we're going to be able to learn so much from people's experience. So we're really encouraging people to use the discussion forum to bring in, the different programs and policies that people are a part of and how we can learn from each other's experience. So we're really excited about that aspect of the course. So again, thank you everybody who's here with us today. And just generally, we want to make sure that this course is as participatory as possible. So feel free, continue to reach out to us and connect to each other to learn from everyone in the course and not just the material that we're presenting here. So I think we can move on to our next sort of set of questions. And so I think from the course platform, we have 2 questions that are particularly related, and both of them have to deal with measurement, which is, I think, a really important theme that we'll be considering throughout the course. So we have Dia Jeka Eisen asks, how long did it take to collect all the data regarding ECD in different countries? And what is your basis in choosing a particular country to present in your lectures? And then we also have Dina Maidarwati, who asks about the use of the mix, right? So this is the UNICEF Early Childhood Development Index. And she says, I would like to know more on the instrument and measurement method that we used in measuring children development level across nations. So she says, within the lecture, it is mentioned, that the mix is one of these things that's being used. And so then she follows up and says, what are the main considerations in gathering information on children through their parents or directly? And then is there any global standard for children's development level on early childhood? And does it vary across countries?
These are great questions, and I think they show the sophistication of our students around thinking around early childhood development measurement. So, just to give you a little bit more of the backstory around the SDG development, I think the global ECD community was very excited that ECD was included in the SDGs beyond survival and mortality. But that took a lot of effort, and to demonstrate that, for example, target 4.2, which is children's development across psychosocial, physical, and cognitive aspects of development, required the demonstration that there was a measure that was being collected in a large number of countries. So the largest effort on that front was the MIX, which is the UNICEF Multiple Indicator Cluster Survey, which are these nationally representative household surveys that have been collected so far in about 80 low and middle income countries around the world. And that was certainly limited to parent report. And so parent report is only one, as you say, of multiple ways to measure children's development. And what has gone on more recently in the ECD field is that now there are some regional efforts to develop measures to track children's development independently. So this is typically with a researcher or an observer coming in and doing some tasks that are somewhat kind of play-based with children to directly measure their responses on items, for example, measuring their attention or their ability to recognize shapes or certain kinds of vocabulary or those kinds of things. Quite a lot of those measures have, of course, been developed within countries. There are some regional efforts across, for example, 7 or 8 countries in East Asia that Nirmala Rao and her colleagues at the University of Hong Kong have developed. There are efforts in Latin America to develop direct early childhood assessments. So that's a very exciting new direction in the field, because direct child assessment can supplement asking parents about how their children are doing. Both are valid forms of data. Parents, of course, spend the most time with their children, so they are very good informants. On the other hand, it's also useful sometimes to have an independent assessment of children learning. So both are important, and the field of ECD measurement is moving forward on both levels right now in terms of both improving the parent-reported or caregiver-reported kinds of measures, as well as the direct child assessments. As far as the basis for country selection, we were trying to represent different regions of the world. We are certainly a course where we're looking for program examples that have shown some research evidence of effectiveness. And so those were also the basis for some of our selection of the program examples that you'll see throughout the course. The next couple weeks, though, are a little bit less about program evaluations and more about how children's development occurs. So there, I think we were going on some of the history of the science of early childhood development, but with attention to cultural variation. So any of your suggestions on additional studies that we could include in future versions of the course, and if you want to share studies with the entire group of students, please feel free to continue to write in on the discussion lines, which I think have been really great as far as the input from students.
Okay, great. Yes, I'd like to follow up on that last point too. We've seen a number of questions in the discussion forum about specific policies or programs and interventions that are working to apply some of this. And so we just want to remind you, the beginning of the course focuses a little bit more on the science and research, and then the further we move along in the course, the more that we'll focus on real programs running in the field and learning from, you know, current practice and policy. But I think that's a great suggestion, that if anyone knows of different policies or programs that you think are particularly interesting and would like to disseminate with the entire course, you know, feel free to write in, and we can think about highlighting them in later webinars or things along those lines. So now we're going to move back to the live forum, and we've got a question from Estibaliz Garcia Recio, who is writing in from Belgium. And she says, as a young working mother myself, I've been thinking about the need to protect mothers financially and socially, so they're not obliged to go back to protective work too early, so they're available to participate and provide appropriate nurturing care. So she's asking, has this issue, protection and support for working mothers, been considered within the SDGs?
Yes, so the area of poverty reduction, and I would refer you to goal 1 as being the most direct goal related to poverty reduction, is tied, I think, in the SDGs to these issues of employment and livelihoods. But I think this is a very good point, that parents as a subgroup are not always mentioned in the SDGs. So under the poverty reduction goal, for example, we don't have, I would say, coming from my perspective, sufficient attention to the particular needs of parents and the particular needs of parents of very young children. Because worldwide, of course, you know, infant development is the time when there is the need for the most parental involvement, as you know, the infants are the most dependent on the care, the minute-to-minute care, the serve and return interactions that Jack Shonkoff talks about, being the most important in the very first 1,000 days, couple years of life, and prenatally. And that paradoxically, of course, is the time, therefore, that family income is the most threatened. So the efforts worldwide to support income during the first months of a child's life are supported through certain kinds of policies that we're going to talk about, as Sarah said, starting in week 4. So weeks 4 through 8 are really about the programs and policies. We'll have entire sessions on social protection policies, which are about poverty reduction, the kinds of supports to support parental employment, and those include child care policies, parental leave policies that provide some wage replacement for parents who are not working very early in their infants' lives. So these paid leave policies are very important. They are in most of the countries of the world. However, they might not be serving all of the families who need them. Then, as more and more parents are going to work earlier in their children's lives, to workplaces where it's very hard to bring their infants, the need for childcare worldwide has increased. So we'll be talking in a later session about the need for out-of-home childcare that is of good quality, and countries that are doing a better job of supporting that kind of childcare. So I'm glad you raised that, and we will have an emphasis on employment, particularly women's employment and maternal employment, but also fathers' involvement later in the course.
Okay, great. So this relates a little bit, I think, to one of the questions we received on the course platform, but again speaks to some of the topics we'll be covering a little later in the course, but just to touch on some of these themes. Mahmoud writes in and says, since it is highly important to strengthen children's ability to reach their potential capacity as future engaged and productive citizens, sustainable development must begin with creating a safe, secure, and healthy environment for children. In this regard, sustainable and responsive investment on children may not only eradicate poverty, but may enhance intergenerational equity for future shared prosperity. What policy lines, strategic approach, and implementing tools do you think may accelerate the best desired outcome? So more on this, poverty reduction, social protection approach to working with very young children. Maybe here you can talk about some of the ideas about financing and funding, just to foreshadow some of the things that come later in the course.
Right. And I think actually we've already talked in the course a little bit about this, that because ECD is a holistic phenomenon that incorporates support of families and communities and young children, and also because it is about supporting kids' health and learning and nutrition, and their families' economic and social well-being, we need ECD policies in order to have that intergenerational effect that you're talking about, be multi-sectoral. So they need to be coordinated across the policies in the areas of health and nutrition, education, social protection, and child protection. So we need this simultaneous emphasis on reducing household poverty, encouraging parental livelihoods and sustainable employment, at the same time that we're talking about supporting children's learning and their health and nutrition. So that's why starting in a couple weeks, the course is going to be structured to go through one major set of sectors a week, essentially. So we'll go through health and nutrition, we'll go through education and social protection, and child protection in about a 2-week span to cover the full set of programs and policies that could support ECD. Just to give a preview, in a couple weeks from now, when Professor Aisha Yousafzai from Harvard has her week, she'll introduce this notion of the different sectors of early childhood development programs and policies by talking about this multi-sectoral approach, and that national ECD policies do need to pay attention to each of these different areas to maximize the intergenerational impacts of investing in young kids.
Okay, great. So we have a question from the live chat from LSC. And so she says that she's interested in learning more about the sensitive periods of the brain and windows of opportunity and the timing of interventions. And her specific question is that Professor Shankov said that infancy, right, so from 0 to 3 years, is the period of maximum plasticity. So what does this mean for children with or at risk for developmental delays? So some children might not learn to talk during this period. Does this mean that they won't learn to talk after they turn 3? And she said that parents often ask her this question.
Yeah, that's a great point. And I just want to emphasize one point that Jack Shankov made, which was that it's not that plasticity goes down to 0 after early childhood. It simply declines. And that means that after the early childhood period, there is relatively more effort required within the environment, whether that's from parents, communities, siblings, peers, or society, to have a long-term influence on children's developmental outcomes. That doesn't mean that it's ever too late. So that's very important, I think, for parents to know, because I think we can overinterpret some of the early childhood data. It is very, very important, of course. While the brain is going through its initial huge spurt of development in the first years, to support aspects like visual, motor, perceptual, language development. And therefore, I think in the arena of child protection, to identify developmental delays as early as possible is actually very important. And that means screening, not just starting with antenatal care and prenatal care, but screening at birth for developmental delays and periodic screening thereafter. Now that's an enormous challenge in particularly in lower income countries. But we're going to be talking later in the course about some approaches that have been successful in bringing widespread screening to populations of young children, and then following that up with services for children with delays. The overall point there would be that if there is a problem early, it is important to try to identify and intervene early. On the other hand, I don't think it ever is too late for families to make a difference, for service providers to make a difference, for programs and policies to make a difference. Just on that point, we're seeing more and more new evidence that there's an additional period in adolescence of brain development when the brain shows some additional a kind of spurt of plasticity and additional growth in areas like the prefrontal cortex that is very important in the period of adolescence. So early childhood is not the end of development. I think Jack Shankov also mentioned that plasticity continues into adulthood and into the aging process towards the end of the human lifespan. So it never goes down to 0, which is optimistic for folks like me, but it is higher. Plasticity is higher. Environmental influences are particularly important in the first years of life.
All right, great. So going back a couple questions. So Tatiana Plata writes in and says, hi, one of the Sustainable Development Goals is granting access to early ECD programs of quality to children. Any ideas about how to assure process quality in low and middle income countries? And Cornelia Peltenberg also writes in to say, do you have further information about quality measurement in ECD programs? And are there results from the MELCO?
Great. These are very up to the minute questions, so thank you for those. Again, we're going to talk, I feel like we can cover the entire course in this. It's a little bit later in the course, we will be talking about the difference between different forms of quality in early childhood development. What Tatiana is referring to is a certain kind of quality called process quality, where actually I'm glad you're mentioning it now, because when Jack Schoenkoff talks about the serve and return aspects of development, that the back and forth responsiveness between what an infant shows in terms of affect or gesture or vocalization and then language, and how quickly a caregiver responds to that appropriately and with a stimulating and responsive reaction is at the core of a form of quality that we're increasingly finding evidence for in ECD programs and policies. And that is that when health workers interacting with children, when home visitors interacting with parents, and when teachers and preschools interacting with children are showing that same kind of responsiveness, we see that children learn more. And that is true whether it's the interaction between a parent and an infant at 6 months or 3 months or 2 months, of course it's with a different level of response when a child is 4 or 5, but it's also true in terms of teaching and instruction in the classroom, for example. So that's a form of quality that is called process quality that is distinguished from structural quality, which is more the basic safety of a facility, the qualifications of the caregivers, for example, the level of education of a teacher, the group size of children being cared for or taught, the ratio of adults to children. Those kinds of things are structural aspects of quality. But the process quality is something that various countries are moving forward in trying to assess as an important feature when they want to know the quality of the services that they're providing, particularly in early childhood education. So the second person who asked the question asked about an initiative called Measuring Early Learning and Quality Outcomes, or MELCO, which is a global initiative to bring this idea of measuring process quality, not just structural quality, into national decision-making and monitoring of programs and policies in early childhood education. So that initiative, I think, is working with particular countries, for example, Tanzania in East Africa, countries like Colombia, Nicaragua, or Peru in Latin America, around the measurement of process quality in national publicly funded early education programs, and also linking those to data on how children are learning. So actual direct measures of children's development and learning. So there are these exciting developments at the country level to start to think about how do we as a country understand what the level of quality of our national early education system is. And that, I think, is also a challenge for family-based programs, health and nutrition programs, social protection programs, and we're going to talk about the notion of quality, which after all is in target 4.2 of the SDGs. Quality early childhood development, care and education is the language in the SDGs. So I'm glad you mentioned the quality. And we'll be talking much more about it in the course.
Okay, great. So we have another question from Debasi Spandari, who is interested in specifically learning more about the Indian perspective. So he writes, do you have any knowledge, attitude, and practice-based data regarding the 1,000 days approach in from the Indian perspective? And he thinks that the, he's saying, I raised my question because it's important to frame communication strategies based on the present knowledge and practice that exists at the community level. So I think that's an interesting question to bring up about having a more localized perspective and how that might relate to some of the more global perspectives that we're talking about.
Sure. And I apologize that I am not up on all of the advances. You know, obviously it's a vast country with a tremendous amount of innovation going on at different levels locally. But the largest early childhood, the largest single early childhood program in the world that is publicly funded, of course, is the Integrated Child Development Services in India, which covers the period of birth to 6 through Angawadi centers, which are community-based programs that could be in the home of somebody in a community, it could be in a center, and these programs nationally have focused to a great degree in the 0 to 3 period on health and nutrition, but I think based in part on some of the recognition that issues like serve and return interactions are important for cognitive development, and both stimulation and responsiveness need to be integrated into health and nutrition programs. I believe the program is moving towards greater emphasis on putting those aspects of intervention, responsiveness, stimulation, and parenting support into the basic health and nutrition supports that are so important. India does still have a very high rate of stunting of children under 5. And so that's why I think for good reasons, the federal government has put a lot of emphasis on supporting the nutrition aspects of the ICDS program. But I think there are now models being developed that would be very important to look at as far as how they are relating to community norms around supporting these issues of serve and return interactions and stimulating very young children's learning in those programs. But again, you know, I think we have a fairly large number of students from India, from a variety of NGOs. I think if you could share some of your program models online in the course discussion part, I think that will be great for people to know. Again, you know, this is a limited course. We don't have time to go into all the innovative program models from all over the world, and the more you all are sharing, hopefully through web links and those kinds of things where we can actually see some examples, that would be terrific.
And we will also be following up. One of our case studies is from Mumbai. So again, a lot of the questions that we're receiving about specific programs and policies and approaches will be diving into some of the details of that later in the course. And another thing that we are going to encourage course participants to do is you can create specific discussion groups. So if you look at the discussion forum and switch to the groups tab, you can see we already have groups for Mexico Save the Children, ECD in Tanzania. So if there's students who are particularly interested in a specific country or cultural context, we'd really encourage you to create a discussion group so that you can get into the specifics there. So just following up with a couple questions from earlier in the chat. We have Soha writing in from Dubai in the UAE, and Zaina writing in from Lebanon. And they're both talking about some of the challenges related to working on ECD in areas of conflict or war zones. So asking if you can share any experiences. And so Zaina, for example, writes, you know, with everything happening in the Middle East, especially in Syria, how can we provide the maximum sort of ECD services for Syrian newborns and children?
Yeah, I'm glad you mentioned that. Our center is now in partnership with the International Rescue Committee around some of these issues of supporting Syrian refugees in countries such as Jordan and Lebanon. As we know, an enormous percentage of children exposed to conflict are not in school. The data we have is less focused on ECD, unfortunately, and more on primary schooling. And so we know that half or over half of children being exposed to conflict and displacement, and that includes, of course, the Syrian refugees as one group, but that's not the only group that's being affected worldwide, of course, by armed conflict. That group, there's been more attention perhaps focused on their lack of access to schooling and a little bit less on ECD, but there is global action now really coalescing on the part of UNICEF around these issues of conflict and supporting children with both the kinds of early education programs that we'll talk about later in the course, but also the kinds of parenting and family support programs for 0 to 3-year-olds. So those are expanding. And I think some of the challenges that are unique are that in some of these contexts, one place we would often turn to, which is a government, a national government that is hosting a new immigrant group, we might expect them to provide services. But if these populations are actually being excluded from these countries, are not being provided access to a timely screening for asylum status, for example, or are in essentially confined in camps or in informal settlements, but without much documentation to allow access to employment, for example, these create big barriers for integration into societies and therefore access to the social services that government provides. And that includes early childhood development services. So it's clear that multilateral NGOs and national NGOs can play a big role in those situations when governments might actually be explicitly excluding populations from access to services. And so that's why I think the multilateral NGOs and UN agencies are playing a very important role for some of these populations. But I would also accentuate that these populations are in a huge variety of different kinds of settings. So we have certainly maybe seen through media what a large tent settlement looks like within a refugee camp. But we perhaps have not seen as much the kind of informal settlements that many refugee populations, including Syrian refugees, are living in, that may be on the outskirts of cities in different countries like Lebanon or Jordan or Turkey, or are in communities now and living among the host society. So each of these have a different picture as far as access to services that depends on whether a particular family has what kind of legal status they have within that country. And then we have to acknowledge that these families are coming in with differing but generally heightened levels of trauma from the exposure to violence that they experienced prior to flight, during their flight across national boundaries, and now in their host society. And we know that outcomes for children are worse when these parents experience discrimination in the host society. And these outcomes for children are worse when exposure to violence has been more severe. So those are all aspects that I think the ECD services have to consider, both in terms of the curriculum that they follow, their approach to emphasizing things like parental well-being and mental health. And I think it's a great example of when Jack Shunkoff talks about toxic stress and what that might mean. So many of these parents and families and kids have been exposed to fairly prolonged periods of very high levels of stress, whether it's exposure to violence, uncertainty about lack of basic shelter and nutrition, those kinds of things. So I'm very glad you mentioned it. We will be talking about issues of ECD in the context of conflict and migration again later in the course.
All right, great. I'm going to loop together a couple of different questions so that I'll touch upon a similar theme. So Krishna asks, does the diverse professions of parents greatly influence the child, right? So, or maybe situations of a single parent or a working mother. And then we have Amy Brown writing in to ask, is there any information about the impact that parents who had poor ECD have on the ECD of their children? And then finally, we have from Elisa Altafim writing in from Brazil. she'd like to know more about two-generation programs or parenting programs. So I think all of these questions touch on this theme of considering children not in isolation, but in relation to their parents and in that sort of familial setting. So two-generation programs and the influence of parents who themselves might not have had access to ECD. So this is all, I think, a really important theme that we can talk about.
I'm glad you mentioned these. So very broadly speaking, three forms of resources and capacities are really important among parents in early childhood. And two of them are socioeconomic. So the level of household income that is sufficient to not live in either absolute poverty, as the United Nations defines it, and also relative poverty, which is the degree to which you are poor within the income distribution of your country, are both important in early childhood. The evidence suggests, in fact, that poverty is more harmful in the long run when it's experienced in early childhood than it is later in childhood. Poverty is never good for kids, but when it's experienced while the brain is going through its most rapid development, it appears to have these most harmful consequences. So supporting family income during this period really is very much important. And it is income that is probably the most powerful factor. On the other hand, I think work conditions of parents also matter. To the degree that work conditions are hazardous, of course, that affects parental health and well-being, and those can affect their ability to provide the kind of serve and return and nurturing interactions. So work conditions also matter. And parental education also matters a great deal. So I think the question about parents with their own backgrounds, perhaps the most powerful factor that can affect early childhood development as far as a parent's own childhood is the quality and the extent of their own education. Because in whatever country where this has been examined, parents with higher levels of education, their kids do better. Their kids themselves go further in school and end up having higher and better outcomes as adults. So I think that's very important. But finally, the set of skills that's very important among parents is what Jack Shonkoff had talked about, which is the ability of parents or any adults in a community to provide the kinds of nurturing care and interactions for children that will bolster their social, emotional, and outcomes and their learning. So two-generation programs are indeed important. They can take different forms. They can take forms like supporting household incomes at the same time that you're encouraging early childhood development. It can take the form of increasing parents' education and job skills, again, while providing supports like early childhood education. And they can be from the kinds of programs that provide support in terms of parenting and health and nutrition for parents, together with opportunities for children to learn. So I think two-generation programs are a very exciting direction in the field. And it's about coordinating these different sectors of services in ECD.
All right, great. So to combine a question from the ECD platform with one of the ones from the live chat, so we had Alexia Reynal write in, and she references one of our readings from the first week. So this is the Black et al. Article from The Lancet. And she quotes that the transition from science to practice on high-quality ECD programs often involves compromises. And so she asks, can you provide details on the kind of challenges that both low and high-income countries face? And so I think this is related to one of the questions we just got in our live chat from Tamara Chansa, thinking about the relationship between innovation and ECD. And she asks if innovation might be lower in low-income countries.
I don't think there's any great way to measure the amount of innovation that's going on. I think as a field, we need to encourage innovation in all the different countries where ECD, where children live, which is everywhere. So that's a focus of the very last week of the course. But the challenge of moving from science to practice and policy is one that the field certainly faces. To some extent, we know some of the basics of what children need, even though there is, of course, cultural and contextual variation. We know that all infants need proper nutrition, they need care, they need those serve and return responsive interactions in the first years of life for brain architecture to develop properly. But moving what we know as far as effective programs for those kinds of factors to scale has been challenging in practically any country that has tried to do it at scale. So parenting programs, for example, I can't think of many examples where they've gone to national scale for the families who need that form of support. There are mechanisms for providing that scale. So, for example, the World Health Organization and UNICEF, maybe this is now about 15 years ago, integrated an emphasis on responsive parenting into their general community health worker curriculum and intervention package for birth to 3, with specific ways that is differentiated for birth to 1 year to 18 months, the infancy, and later in toddlerhood. So that to some extent is at scale in the sense that community health workers worldwide are expected to integrate this module on responsive feeding and stimulation into their basic repertoire of services that are around immunization, basic health screenings, dealing with the big killers of children in the first years of life, which are things like diarrheal diseases, respiratory infections, malaria, tuberculosis, preventing mother-to-child transmission of HIV/AIDS. All of those aspects are on their menu of what to do. But as you can tell, that means that they have a lot to do with families, and integrating this emphasis on parenting is difficult to do at scale because these are workforces that aren't necessarily paid in low-income countries. And if they are, they might not be paid regularly. Their level of training differs, so you can have curricula, but perhaps they're not being implemented evenly. So those are some of the challenges of going to scale. A famous Jamaican program with long-term effects called the Roving Caregivers Program, which we'll talk about a little bit later in the course, now has materials for countries to then adapt and take to scale. So there is now a global effort to try to take some of these evidence-based practices and move them to scale within countries. But there's a lot more we need to learn about those issues. And that's why I think much of this course will move to how we think about programming with quality services at scale. Glad you raised these questions.
All right, great. I'd just like to acknowledge, so both Krishna Joshi and A.G. Babu have written in to talk about some of their own experience. So Krishna saying that he's had the opportunity to work with the Integrated Child Development Service Program in India, and A.G. saying he's going to share some of their ECD module in India. So that's really great. We really appreciate you writing in with your experience. And I think that's a great segue to one of the questions we received. So Valerie Colgate writes in, she's a master's student in global health, and she's wondering what kind of recommendations do we have for either volunteer or employment opportunities. So just referencing, our course participants from India, I think talking to each other and having different conversations amongst the course participants is a great way in which to explore different volunteer and employment opportunities. But here, do you want to talk at all about what your perspective might be?
Yeah, so I think the first place to start for all students in the course is the communities they live in and what ECD programs and are being implemented there in the particular interest area where you are most interested. So that's really the community that you know best. And so I think those are the places that I suggest starting. Unfortunately, as a course, we don't have the resources to actually hook people up with particular employment opportunities. But I think the course participants themselves are a huge resource. So I think that is something that, you know, when as some students just did, you know, have shared some program models that they have worked with or are familiar with. We can certainly encourage students to share that kind of information. We have an enormous range, I think, of NGOs reflected among the students in the course. And by the way, that doesn't mean you have to be working in one of them in order to take the course. I think we do have a lot of people working in the field reflected, but I think it's perfectly fine for this course to be your first exposure to the field of child development, human development, and early childhood development in particular. And I do know we have some students who have come in from the gateway of the SDG Academy, and so have taken other courses on the SDG website, which means that they have taken courses really in very different areas of international development. So, so I think those broader perspectives are also useful, even if child development is kind of new to you. So, yeah.
All right, great. So we have a question from Leonard writing in from Kenya. And he's wondering if we might know of any newer studies apart from the Jamaican study, maybe from different contexts or different environments. And so I just want to follow up briefly to say too that in addition to the readings that we're assigning as part of the course, we'll also be providing some information on additional references. So particularly those that are referenced in the lecture videos of the course, we'll be uploading some materials so that we have external resources available to you. So that's definitely something we can continue on the course platform. But here, are there any other studies or innovative research projects out there that you think might be relevant to bring up?
Sure. We don't have the capacity to list every innovation that's going on, but the ones that have entered the scientific evaluation literature are the ones that we're more aware of. And I would refer you to an article that I think has been, the link to it has been posted on the discussion threads, and that is the second paper in the Lancet series. I think we assigned the first paper by Maureen Black is the first author. The second paper is called Nurturing Care, and it's Pia Brito, who will be joining our last week of the course, who is the Chief of Early Childhood Development for UNICEF headquarters. She is the first author on the article that reviews what we know today about parenting programs in low and middle income countries. So that article's references go far beyond the Jamaica study to talk about the other program models for parenting that have been shown to be effective. So, so I would refer you to that. And we could certainly send around the link to that article, which is the current state of the art, I think, in the scientific literature on that form of intervention.
Okay, great. And so we're approaching the end of our time here. So just one of the latest comments coming in from Tasmin Jamal in Kenya. She brings up the issue of gender, which I think, and issues of equity is something we mentioned a little earlier in the platform or in today's webinar in relation to children who potentially have developmental delays. But I think bringing up gender and considering equity will be a great last theme for us to think about in today's webinar.
Sure. Again, I think we have to take a multi-generational approach to thinking about gender equity in early childhood, because we can think about the kids and whether boys and girls have equal access to different forms of quality ECD services, including for children with developmental delays. And then I think we need to also think about parents and the issues of gender equity, like the wage differentials that we see worldwide in terms of women's work versus men's work. So, and the particular household structures and the way that gender equity also plays out in households. So these are very important themes. We can, I think, also distribute some of the basics around issues of access for children, because the global sources of data on access, at least for some very basic things like pre-primary education, have been broken up by gender, and there have been improvements in the gender equity of access to pre-primary education worldwide, with some regions really leading the way. So Latin America, for example, has achieved essentially most of its countries gender parity in access to pre-primary education. That doesn't mean that the access is high in every country, but the access is relatively equal. And that's not true in all the countries of the world, and so there are regional and country differences as far as that goes. And then I think this comes up to a great degree around women's access to livelihoods, employment, and sufficient wages in many countries to support their employment. We're also going to talk about women's representation in governance and whether that actually has an impact on early childhood development. So we'll be talking later in the course about a very interesting study from India about what greater representation of women in rural village governance, how that is related to improvements in early childhood development. So I'm glad you raised the issue. We'll be coming back to it from time to time over the course.
Okay, great. And in just our final moments, we have a question from Mozem Hossein asking about a multiplier approach to ECD. So thinking about the life cycle approach, he writes, establishing interconnection among different developmental needs of different stages.
Yes, I think one interesting example of that is how to think about older siblings and their role in supporting younger children's development. So that again will be coming up later in the course, but that's an example of how there may be opportunities for youth to get involved in ways that are productive in helping. And of course, in much of the world, siblings are doing an important part of the caregiving for young kids. So I think that's part of probably what you mean as far as multipliers, so that we're not just thinking about parents and their role as adults. Parents and professionals or paraprofessionals in terms of their role, but also thinking about older siblings. These have been really great questions. I think our next scheduled hangout is going to be the week after next with Kathy Tamas-Lamanda, who is the professor for this week. She covers the material for prenatal to age 3 development. And so there will be a hangout to ask her questions about her expertise between prenatal and age 3, week after next. So thank you all for your great questions.
Yeah, thank you so much for being with us here today. We're also going to try and schedule webinars for slightly different times. We had a message come in from some participants in East Asia saying that this might be a difficult time zone. So any feedback on the webinars, we're really hoping to engage people. All of this has been recorded today, so we will be posting it to the website so that it's accessible for anybody who missed, or if you'd like to follow up. And I've been taking some notes from some of the questions you've been bringing up, so we'll be following up with links, for example, from the Lancet articles and other resources that we can make available to you. Thank you so much for participating with us. It's been such a pleasure. We're really excited to get to know you. So please feel free to continue to write in the discussion groups, introducing yourself on some of your background and engaging with your fellow students. And we look forward to seeing you at our next hangout. So thank you so much.
Thanks, everyone. Bye-bye.